The government thinks this woman is dying in hospice care, but she just humiliated me, schooled me on the pickleball court. She's definitely not dying. She is a victim, though, of hospice fraud. So, hospice fraud costs taxpayers hundreds of millions of dollars every year, and California is ground zero. So, basically, people steal Medicare numbers, they enroll them in hospices, and then bill for tens, sometimes hundreds of thousands of dollars. A lot of these companies are just fronts. So, over 700 of the roughly 1,800 hospices in LA County trigger multiple red flags for possible fraud. So we went door to door, and what we found was empty office spaces, piled up mail, and not a single healthcare worker in sight. There's even a stretch in LA with 500 registered hospice companies within just 3 miles of each other. In fact, there's even a single building with 89 registered hospice companies. We wanted to get some answers. Okay, so my name is Adam Yamaguchi, and I'm with CBS News. And we're doing a story about hospice, and we're just trying to understand how and why there's so many hospice agencies in like a small cluster in LA County. Would love to speak with you. I'm sorry? You have no comment? Okay. All right.
So we got to talk about this because CBS just took a page straight out of Nick Shirley's playbook, and the irony here is actually wild because for the longest time we were told that Nick Shirley isn't a real journalist. What he was doing wasn't journalism, according to the mainstream liberal media. It was harassment, it was racism, it was hate, it was bigotry. That's what we were told. But apparently that only applies when he does it. Because now when the mainstream media copies the exact same thing, suddenly it's investigative journalism. Now it's brave reporting. Now it's accountability. And what are they doing? They're literally picking up or pulling up to sketchy businesses, I should say, that are taking government taxpayer dollars, knocking on doors, calling phone numbers, looking at the offices, and trying to figure out if these companies collecting public money are actually providing the service they claim to provide. That's it. That's the whole concept. And if a business is taking taxpayer money, it is completely reasonable to ask a very simple question. Are they actually doing what they're being paid to do? Because the reality is that these businesses are being funded by you, by me, by everybody watching this video as we speak. So here's where the story actually gets interesting, as I want to show you guys in regards to the matter. Because when CBS started doing some very basic journalism, they discovered something that honestly shouldn't surprise anybody who has been paying attention, despite Democrats in California claiming that they've been cracking down on hospice fraud. And there are still a significant number of these allegedly fraudulent hospice businesses operating all over Los Angeles. But if you think about that for a minute, the state knows there's a problem, they acknowledge there's a problem, they say they're cracking down on it, and yet these businesses are still operating. They're still open. They are still able to bill the government, which raises a pretty obvious question. If regulators already know what these fraudulent businesses look like and they say they are cracking down on them, then why are so many of them still active? Why are they still collecting taxpayer money? And that's the part that doesn't make sense. So this CBS reporter decides to do something very simple. He actually goes out into the field and starts checking these places himself. He starts knocking on doors, visiting the business addresses, calling the phone numbers listed for these hospice companies, basic investigative reporting. And what does he find? The exact same pattern people have been pointing out in other fraud investigations for years. He knocks on the door, no answer. He calls the phone number, it goes straight to voicemail. The office looks empty, no staff, no patients, no sign that an actual healthcare service is being run out of the building. Now remember, these are supposed to be medical care providers receiving money through Medicare to care for patients at the end of their lives. And you would expect people to be there, nurses, administrators, patients, or at least signs that a real healthcare operation is functioning. But instead, what he's finding are offices that look inactive or abandoned. And here's where the hypocrisy becomes impossible to ignore. Because when Nick Shirley was doing this exact same type of reporting before, pulling up to businesses, knocking on doors, asking questions, the mainstream liberal media said there was nothing suspicious about that. They said businesses don't need to answer their doors. They said companies don't have to pick up the phone during the day. They said it wasn't evidence of anything. In fact, they went even further than that and they accused him of targeting people. They accused him of racism. They claimed he was just picking on Somali communities when he was investigating the daycare fraud scandal in Minneapolis, Minnesota. That was the narrative. But now you got CBS reporter in Los Angeles doing the exact same thing, using the exact same method, and suddenly the same red flags appear again. Because this pattern isn't new. We saw similar issues during the Somali daycare fraud investigation in Minneapolis, where businesses were billing the government for services that investigators later questioned whether they were actually providing. And it didn't stop at daycare programs either. There were also Medicaid funded operations claiming to provide services for elderly and disabled individuals. And the core issue in those cases was the exact same thing investigators are worried about here. Companies billing the government for services while the actual services either aren't happening or aren't happening at the level they claim. And when that happens, it creates a very simple but serious problem. These businesses can end up overbilling the government, collecting huge amounts of taxpayer money while the people these programs are supposed to help don't actually receive the care they are promised. Meanwhile, the people running the operations can end up living extremely well off those payments, nice homes, expensive lifestyles, all funded by money that came from taxpayers. And here's the part that makes this even worse. The damage from fraud like this doesn't just affect government budgets. It affects real patients, especially seniors, because when someone fraudulently signs seniors up for services like hospice care, using their information, the system records that those services are already being provided, but the seniors themselves might not even know they were enrolled. So later, when they go seek legitimate medical care, the care they're entitled to under Medicare, they could run into serious problems. And the system may show that services have already been billed under their name. Claims may have already been filed, which means the patient suddenly has to fight through paperwork, file disputes, and prove that they never actually received the services in the first place. So imagine being a senior, dealing with a serious health issue and finding out that your Medicare benefits appear to be already used because some company fraudulently billed the government under your name. Now you stuck navigating bureaucracy while you're trying to get medical treatment. And that's the real world consequence of fraud like this. It doesn't just drain taxpayer money, it can literally delay or block people from receiving the health care they need. And yet, when people talk about investigating fraud inside programs like Medicare and Medicaid, Democrats immediately accuse Republicans of trying to take health care away from people. But the irony is that fraud itself what ends up taking health care away from people, especially seniors who rely on these programs, instead of focusing on eliminating the fraud so the money actually reaches patients. The political response is often to shut down the conversation entirely. Nothing to see here. Don't investigate. Don't audit. Don't dig into the system. And you saw the same reaction when people like Elon Musk start talking about looking into government spending and waste inside federal programs. And the political establishment immediately start panicking. Don't touch Medicare. Don't investigate. Leave the system alone. These are all the things they were saying, especially on the Democratic side. But stories like this show exactly why oversight matters. Because if a reporter can literally drive to a location, knock on the door, and immediately spot the warning signs of a fraudulent operation, then it raises a very uncomfortable question. Why weren't regulators already doing the same thing? And why are taxpayers footing the bill for what could be hundreds of millions of dollars in fraud while political leaders insist there's nothing to worry about and anyone who questions it must be pushing some kind of MAGA conspiracy? Well, with no further ado, let's check it out.
But 69-year-old Dr. Lynn Ianni just ran me up and down the pickleball court. But 2 years ago, she was, according to Medicare records, dying in hospice care.
I was in treatment as physical therapy, simply because I had had kind of an injury on the pickleball court. The administrator at the office was like, they're not going to pay any of your claims. And I was shocked. They said, you're in hospice. And I said, what? What are you talking about? Are you kidding me? Do I look like I'm in hospice? She goes, no, I know you. And when
Ianni's Medicare number had been stolen and used by a company to fraudulently enroll her in hospice care, which she obviously didn't need. That meant Ioni had no coverage and no easy way of getting unenrolled from hospice. Obviously, this was a major hassle, lots of phone calls, lots of paperwork. What were the medical consequences?
I was terrified. I mean, something can happen. That's why you have health insurance of any kind. And just to think you're literally without coverage because of some ridiculous, fraudulent thing.
My name is Adam Yamaguchi. I'm with CBS News. A CBS News investigation found an industry ripe for fraud, especially in California. Companies accused of overbilling, real patients denied care, and it's costing hundreds of millions of taxpayer dollars. The hospice Ioni was fraudulently enrolled in is called Fortuna. When we called, no one answered.
The mailbox is full and cannot accept any messages at this time.
The state of California increased monitoring of the hospice industry 4 years ago, identifying the hallmarks of fraud. Fortuna has 2 of them, and it's hardly alone. CBS News analyzed every hospice licensed in LA County, more than 1,700, and checked for the same warning signs the state used, like multiple hospices packed into one building, or caregivers whose patients, supposedly at death's door, are discharged alive. 3 years after the state crackdown, which included a moratorium on new hospice licenses, our investigation found more than 40% of agencies still show at least 3 of these state-defined indicators of potential fraud. So Victory Boulevard seems to be a hotbed of...
Yep, you can't throw a rock without hitting a hospice.
Sheila Clark, a hospice patient advocate, took us to what she described as the ground zero for hospice fraud, a 3-mile stretch of Los Angeles that's home to nearly 500 hospice company offices. There's one hospice here that hits all 6 of California's red flags of possible fraud.
Well, there's
Says
no
it's a
hospice there.
Legal office.
Yeah.
With a ton of mail just
Yeah,
sitting there.
look at this.
This agency, VML, hit every fraud indicator in our analysis and billed Medicare roughly $49,000 per patient, about 3.5 times the national average.
They need their curative treatment. They need their they need to be taken care of. They need to know that they can get what they need when they need it, not hit a roadblock because somebody's scammed them.
The number you dialed is not in service.
Clark tells us when offices like these close abruptly, it's real patients in desperate need who pay the price. How does that make you feel as somebody who deals with patients who need this?
Sad, really sad, because I talk to them every day. I'm sorry, I can't.
I wonder how they can go for a full year and still not have their license revoked. Is that a systemic failure?
We need to be responsive to the red flags and react to them, not just count them, but do something, take action. Our main lane is the accountability side, the criminal investigations, the civil investigations. That's after the damage is done, though, unfortunately.
State Attorney General Rob Bonta says his office has brought hospice fraud criminal cases against 109 defendants and about 24 civil cases. What would you say to citizens who are throwing up their hands and saying, how long is this going to persist? Is my government doing anything to protect my taxpayer dollars?
Again, I share it. I have the frustration. So to the citizens that remain frustrated, I understand. I share your frustration. Please know that we have increased our efforts. We're working overtime on prevention and on accountability.
Bullshit. That's bullshit. That's bullshit right there. But the simple fact is, what really makes this story unbelievable is while all of this is happening, you have the Attorney General of California telling reporters they're cracking down on hospice fraud, like he just said. But they're rooting it out, they're investigating, they're taking it serious. But at the same time, this CBS reporter can literally drive to these locations within minutes and see the markers of fraudulent operation. Think about that. The reporter identifies a business that fits the fraud profile, pulls up to the address, and immediately notices something is wrong. And why is it a civil case if obviously it should be a federal case because you're using government taxpayer dollars and committing fraud? So not only are you holding them accountable at the least extent, but then also it's just making it more passive because you sitting there saying you actually fighting for the people. But how can you if you ain't even doing nothing? Do something. That's the key word. So he's saying it's 109 or however many people. But the reality is, if the people aren't being convicted, is it really saying that? Is it really showing that you're doing anything? See, actions speak louder than words, and this man is full of shit, and he's not doing nothing. The reporter identifies a business that fits the fraud profile, pulls up to the address, and immediately notices something wrong. Nobody's there, no patients are receiving care, the phones don't work, The place looks abandoned. If a journalist can spot that in 5 minutes, then it raises a very simple question. Why hasn't the state already shut it down? Because we're not talking about a few $1,000s here. We're talking about hundreds of millions of dollars potentially being billed to taxpayers. The money is coming from Medicare, right? That means it's coming from the taxes people across the country pay every single year. Americans are footing the bill for healthcare services that may not even exist, and yet these businesses are still operating, and they're still being able to build a system, and that's the part that makes people question whether anyone in charge is actually serious about stopping the fraud. Let's continue and wrap this up, family, and I want to get you guys' thoughts down in the comments below.
And we will continue until hospice fraud in California is rooted out.
CBS News reached out to the almost 60 hospices that have 5 or more flags. Many numbers were disconnected or went straight to voicemail. Representatives at some others denied any fraud and said they run legitimate hospices with real patients. Back in Van Nuys, we tried the hospice right next door to VML. We knocked, then called during the posted business hours.
You can't leave a message because the person you call has a voicemail box that hasn't been set up yet.
Wow.
Bye.
We couldn't reach anyone, and we'd soon realize these operations may be connected, part of what advocates describe as a web of hospice agencies that come and go, but continue submitting a steady stream of bills to taxpayers, whether the patients are dying or, like Ayani, are still out playing pickleball.
And this is where the hypocrisy really starts to show, because when people outside the mainstream media were pointing out these kinds of issues, they were dismissed as conspiracy theories. Now, like, they were accused of spreading hate and they were accused of targeting communities. But now the mainstream media is uncovering the exact same type of patterns, using the exact same investigative methods, and suddenly it's a legitimate story. And that should make people stop and think for a second. Maybe the issue was never the investigation itself. Maybe the issue was that the wrong people were asking the questions. Because when the media ignores the problem for years, fraud has time to grow. Businesses that are gaming the system become more sophisticated. They collect more money. They expand their operations. And by the time a major outlet finally investigates the issue, the scale of the fraud can already be massive. And that's why journalism like this actually matters. Imagine if major networks like CNN, ABC, NBC, and CBS had been focusing on stories like this years ago, instead of waiting until the fraud became impossible to ignore. Imagine if investigative reporters were regularly checking government-funded programs to make sure the services were actually being provided. If that kind of oversight existed consistently, fraud schemes wouldn't be able to grow in operations worth hundreds of millions of dollars. In the moment people realized someone was watching, the incentive to cheat the system would drop dramatically. Accountability only works when someone is actually paying attention. But instead, stories like this often get ignored until independent journalists or investigators start raising alarms. And then eventually the mainstream media shows up and suddenly everyone acts shocked that the problem exists. And the political implications of this are pretty obvious. Programs like Medicare and Medicaid involve enormous amounts of money flowing through thousands of different providers. Anytime you have a system that large, fraud becomes a real risk. And that's why oversight and investigations are supposed to be a constant part of the process. But if political leaders treat every attempt to investigate fraud as an attack on the program itself, it creates a situation where abuse can continue unchecked. And when stories like this finally come out, it damages public trust in the entire system, because people start wondering how many other operations like this exist that haven't been exposed yet. And if fraudulent hospice providers can operate in a major city like Los Angeles, how many other industries connected to government healthcare funding might have similar problems? And that's the big question this story raises. Hospice care is just one part of the healthcare system that bills Medicare and Medicaid. There are also companies providing home health care, disability services, elderly assistance programs, medical transportation, therapy services, and dozens of other categories that receive government reimbursement. And if investigators are finding fraud patterns in one area, it's reasonable to ask whether similar schemes might exist in others. And if that's the case, then the scale of the problem could be far larger than what we're seeing in this one story. At the end of the day, what makes this situation fascinating is that once again, the so-called right-wing conspiracy theorists end up being right about something the political establishment insisted wasn't happening. People were raising concerns about fraud in government-funded programs long before the mainstream media started investigating it. And they were told they were crazy. They were told they were spreading misinformation. And now the major outlet goes out and finds the exact same red flag sitting right in front of them. And that doesn't mean every business receiving government funding is fraudulent. But it does mean the system clearly has vulnerabilities that bad actors can exploit if nobody is paying attention. And if fraud like this can exist inside the hospice industry, It's hard not to wonder how many other Medicare or Medicaid funded businesses might be operating the same way. Because when billions of dollars are moving through a system, there will always be people looking for ways to game it. So again, this is a huge story, and we're talking about potentially hundreds of millions of dollars in fraudulent billing tied to government healthcare programs. And if reporters are able to uncover red flags just by showing up to these addresses and asking basic questions, then it raises serious concerns about how much of this is happening elsewhere across the country. And I wouldn't be surprised if there are plenty of other businesses out there doing the exact same thing. But that's just my take on it. Let me know what you guys think. Do you think there are more industries inside Medicare and Medicaid where this kind of fraud might be happening? Drop your thoughts down in the comments below. Make sure you like the video, subscribe to the channel, and I'll see you in the next one. Peace.